Hi everyone. Today we're going to talk about cupping therapy. It's one kind of Chinese medicine, a technique that we use very often. We know in Chinese medicine we have different way to make treatments, such as acupuncture, such as Chinese herbal medicine. Chinese herbal medicine, we can say is our medication, and we also use Tuina. Tuina is one kind of therapeutic massage and guasa, and we also have cupping therapy. It's very interesting. In fact, cupping therapy is not only China use it. We found in our history, in the history of humankind, in some Asian countries such as Egypt, such as Mid Eastern countries such as Greek, they also used cupping. Even the father of modern medicine, Hippocrates, he also mentioned cupping therapy inside his books or inside his works. So what is cupping therapy? We say cupping therapy, of course, use the cup as a tool, and normally we use fire or suction or some other methods to remove the air inside the cup. Why? Because like this, it can get resulting in negative pressure, so the cup can absorb on a specific part of our body, such as some points, such as some affected area, and resulting in extensive stimulation, resulting in local congestion. It is a treatment method for the purpose not only for treat disease, it also used for preventing disease or strengthen the body. So the cups we use before, we use a lot of cups of bamboo, because I think the glass that today we use, it doesn't have a very long history. So before we use bamboo cups and or earthware cups, and nowadays we use more glass cups. But the glass cups or the earthware cups, they have one kind of disadvantage, is that they break easily. So today we also use this kind of silicone cups, or some cups that are made from plastic. So when we want to make cupping therapy, first we needed to prepare the cupping area and to prepare the patient. Normally, the cupping area should be areas with rich muscles, less hair, and sometimes we also make cupping with acupuncture at the same time. And the patient, since the patient needs to stay 10 or 15 or 20 minutes with the cups, so normally we ask the patient to choose the appropriate position according to the cupping area. Imagine if you want to make cupping on the back, maybe you need to ask the patient to lay down with the abdomen. And then when we want to begin the cupping therapy, first we also needed to sterilize the area. And Or we also need to sterilize the cups that we will use for the patient. Because if you have many patients, imagine many of them needed to make cupping, and we needed to sterilize very well the cups to avoid the infection of disease. There are several ways to make cupping therapy, such as dry cupping. We call it dry cupping. This kind of method, normally we use fire to remove the air inside the cups. We also have another way, is the water cupping. Nowadays, we don't use very often this method, because first we needed to boil the cups in a pot with water, remove the boiling water in the cups, and then use a wet towel to rub the mouth of the pot tightly, and then back it on the cupping area with while hot. So the process to do water cupping is very complicated. Today we don't use it very often. And the third way, the pumping method. This is very popular nowadays in China, maybe in the other country also, to make cupping therapy. First, we fasten the prepared air extraction cup on the cupping area, and then we use the pump to extract the air, to remove the air in the cup to generate negative pressure. And normally these kind of cups were made with silicone or plastic. And sometimes we can find in some movie, and they show the way to make cupping therapy. Then after finish the time of treatment, you can find that they try to withdraw the needle, withdraw the cups with very strong strength. But it is not the right way to remove the cups. You can find it in some movie or some show, but it is not the right way. The right way to remove the cups, normally we need to hold the cup body with one hand, and the bottom of the waist is tightly inclined, and the other finger press the skin on the edge of the cup mouth, so then the air can enter the cups, and the cup can fill itself, and the patient normally doesn't feel any pain when we withdraw the needle, withdraw the cups. So the reaction of cupping, sometimes if you don't know what kind of treatment the person has done, maybe you will feel strange, or sometimes you will feel afraid. We can see some very famous stars in the world, such as this guy, and this sportsman, and our friends. All of them like so much to do cupping therapy. Why? Because it can help them to relieve the pain, the muscle pain, and it also can help the sportsmen to improve their achievements, and there is a natural way to improve the achievements. So after we put the cups on the body of the patient, then what we need to do? Here is the way. There are several ways to continue the treatment of cupping therapy. The first one is the very normal and very common way that we do. We leave the cups for 5 or 15 minutes after cupping. Or the second one, we call it the flash cupping. Involves quick, repeated suction and relief of the cups on an area of the body. Then we will show you how to do it. Or we also can do moving cupping. Involves moving suction cups around the body after applying oil to massage the desired area. Normally, this method is used for big area of pain or muscle pain. Or sometimes we also do needle cupping. It means we put first the acupuncture needle, then we put the cup on the needle. I will show you then. Or the fifth way is bleed cupping. In China, we do it a lot. But in the other countries, such as European country, maybe they don't use this way very often. So why cupping therapy can help a lot for our health? As I said, not only China, even in Egypt, even in Greek, they also used cupping therapy. Some of my Portuguese students, and they told me that when he was little, he saw his grandmother do cupping for his grandpa. So this kind of therapy, even today, some European old people, they continue to make it. And here is the effects of cupping therapy. The first one is promoting the skin blood flow. Imagine if you have a pain, if we can do something to promote the blood flow, normally the pain can be relieved. The second is change the skin biomechanical property, such as improve the quantity of white blood cell. So we can say it can help for some kind of inflammation. The third one is increasing the pain threshold. It means it can use for pain. The first one is improving the local aerobic metabolism. And the sixth is reducing from inflammation, as I said. And the last one is boosting cellular immunity. It can improve your immunity system. Of course, not everyone can make cupping therapy. We need to know what kind of precautions we need to study before applying cupping. First, we need the requirements for the treatment room. Normally, we need a bright and calm space for the patient to relax, and then we begin to make the treatment of cupping therapy. Second, we need to ask to choose the right or choose the appropriate body position and the right size of the cups. Imagine if you wanted to make cupping therapy on your head, maybe you need to use the small size of cups. If you want to make cupping therapy on your abdomen, maybe you need to choose the big size of cups. The third, for the older person, imagine the child and then those people with very poor constitution, those people, very weak people, the number of cups should be less, and the time of retaining cups should be short, not maybe 5 minutes, maybe 10 minutes, not too long. and pay attention to ask the patients how they feel after put the cups, and observe local and systemic reaction. And after put cups or after applying the cupping therapy, if the patient feel dizziness, it happens, but not so often. If this happens, the patient feel dizziness or sometimes nausea or sometimes feel cold on the limbs or even sweat, but with cold sweating. It can happen, but not often. And what we do, first we need to remove the cups in time. Don't wait, remove it. And then we do some other treatment to relieve or to reduce or to resolve this kind of reaction. And there are some situations that we need to try to avoid to make cupping therapy here, such as some kind of acute severe disease, such as contact infectious disease. Why? Because if you don't have the very good condition to sterilize the cups or sterilize the patient, maybe you can pass the disease to another patient. And for some severe heart disease, such as heart failure, and we also need to avoid the cupping therapy. And other diseases such as hemorrhagic disease, of course, if you make cupping therapy, maybe it can make the patient bleed a lot. And this acute traumatic fracture, of course, we don't make cupping therapy. And if the patient is a very highly allergic person, imagine he is very highly allergic with very highly allergic skin, or he is with severe infection, skin disease, or some such as skin tumor, maybe we don't recommend to make cupping therapy. We also don't make cupping therapy for pregnant women, especially in the abdomen area, because it maybe can cause abortion. And for some patient has no condition to accept this kind of treatment, such as a patient with very severe psychological disease, we can do cupping therapy. Or someone, when he arrives your consultation, he is very tired, very drunken. Of course, we also don't make cupping therapy. So here are some special situations that we need to avoid to make cupping therapy. Nowadays in China, in Chinese medicine hospital, our cupping therapy is used for most of the common disease, such as some internal disease, such as fever, such as acute bronchitis, such as constipation, such as chronic diarrhea. We use it a lot. And we also use for gynecological diseases, such as dysmenorrhea, such as irregular menstruation, amenorrhea, or pelvic inflammatory disease. And we also use for the pediatric diseases, fever, diarrhea, or whooping cough. And we also use for some surgical disease and skin disease and some disease of your eye, of your teeth, or situations similar. Now I will show you how to do cupping. First, we need to sterilize the operation area. Today we use fire to remove the air inside the cup very quickly. Now I will show you the needle cupping. First, we put a needle in the point. After we put the needle, then we put the cup on the needle. This is the needle cupping. Okay, now I will show you the moving cupping. First, we need to sterilize the operation area. Then we put oil or some kind of massaging cream. The same, we use a fire to remove the air inside the cup and then do this movement. Normally is follow the acupuncture meridian or the direction of the muscle. This is the moving cupping. Now I will show you how to do flush cupping. The same. First, we sterilize the operation area. And we repeat this movement for 10 or more times. Flush cupping normally is for local pain. So that's all for the cupping therapy. I hope we have more opportunity to study together. Thank you.